Good morning, everybody. So, for today's Wellness Wednesday, we're going to talk about COVID and hyperbaric oxygen therapy. I have been getting a lot of questions about this one within the last couple weeks, and that's partially due to COVID getting back in the news here and blah, blah, all that junk. So, the one that we've got a lot of questions, or that I've got a lot of questions on, is COVID in general and long-haul COVID. So long-haul COVID is becoming exceedingly common. It's just lingering systems, people with lingering heart issues, breathing issues, neurological issues, seeing a lot of that stuff, and hearing about a lot more of it too, especially the neuritis, which is nerve irritation or neuropathy. So what we're going to do today is jump in to some info just on COVID in general, and then we'll hit the benefits like we have been. And as always, drop your questions, comments in the video below. I will try to get the links. What do I have here? 4 of them. So this research is being done right now. It's being done in the United States, it's being done all over the world, and there's awesome stuff coming out of it. So let's dive in. So COVID-19 and hyperbarics, the relatively novel virus created a pretty unprecedented challenge within our healthcare system. I think we're all well aware of that. It overran the hospitals, and it caused an alarmingly high mortality rate within critical care facilities. So as science is catching up to this, early clinical reports and anatomical findings show one of the primary mechanisms on how people are getting hurt is called progressive hypoxemia, so decreased oxygenation reaching your tissues, and that's the main cause of deterioration in people with COVID-19. And persistent in the long haulers. So as hypoxemia progresses, standard therapy cannot penetrate the diffusion barriers within the body, so the pressure gradients. It's limited by ambient, so pressure that surrounds us in the room. The preliminary evidence on HBOT is showing that it's not limited by this because it increases the pressure, or as we say, it dives, because it does mimic diving. This has actually been shown to drastically improve patients' conditions, especially in early intervention. So the sooner you get after these long-haul type things, the better the people do. So let's get into some of the benefits of HBOT. It's been shown to cause a rapid relief of hypoxic symptoms, decreases dyspnea, that's the difficulty breathing. It improves, you ready for this, liver function and reduces myocardial injury. A gradual improvement in arterial blood gas, which you can check with a pulse oximeter. It's shown to be safe during ventilation as well, which is cool. Helps decrease chest pain. Improved lung pathology. Some people are actually showing up with adhesion, scar tissue in the lungs. And it increases your blood oxygen saturation, which you also measure with a pulse oximeter. So, super, super cool. Now, what it's been shown to do on a smaller level is actually, while it does hyperoxygenate the bloodstream, which includes the red blood cell and the plasma, it also actually helps regrow the capillary beds so we can begin to regenerate tissues as a result of this. It's called Crow's Law. So, and which will then help basically clear the sludge, reduce the cytokines, reduce the inflammation off of your nervous system. So that's one of the mechanisms on it, how it helps these people with neuropathy, neuritis type things. So as always, if you gals and guys have any questions or comments, drop them in the video below. I will answer them as soon as I see them. Facebook is still being super awful weird. Sometimes I don't see him for a couple days. I'll definitely get back to you. Have a great day, P.L.L.C. See ya.